Good morning. Tear Ferning test, inexpensive valuable tool in MGD. Hello? It's not changing. Slides not changing. So MGD is characterized by a chronic diffuse abnormality of the meibomian gland, terminal duct obstruction, and qualitative or quantitative changes in the glandular secretion. It may result in the alteration of tear film also. It is a most under-recognized, underappreciated and undertreated disease, so common as to be taken as a normal in many clinical practices. The diagnosis and quantification of MGD require assessment of the symptoms, altered meibomian secretion, changes in the lid morphology and the meibomian dropout. That requires lot of very expensive equipments. So MGD is one of the most common disorder which is recognized as a major cause of dry eye. Clinical signs and symptoms of dry eye are poorly correlated, makes its management difficult. So the tear film irregularities can lead to inaccurate preoperative K readings and mistaken IOL powers. Visual results of the refractive surgery is largely dependent on this. Undertreated MGD can put cataract patients at a higher risk. So what is important is to evaluate the role of this tear funding test in MGD. It was a prospective observational study done in the Riva at 80 patients of 20 to 25 years of the age, having willing to sign the consent and having MGD, excluded any ocular surgery, corneal pathologies, lid abnormality and those not willing to sign. All the cases differ from the aqueous deficiency dry eye. Two conditions share the medical clinical feature. All the symptoms present of the MGD, grading done according to the classification, and what is done is unstimulated tear were collected from the lower meniscus of the subjects using a capillary tube, and sample was then dropped onto the slide and observed using a light microscope 40x magnification, and Ronaldo's tear Ferning classification was used to categorize. So the pattern where type 1, 2, 3 and 4 were noted. Maximum number of the patients were female and MGD grading maximum was in grade 2 and the number of patients maximum were in grade 2. MGD Ferning pattern seen is maximum number in grade 2 and Schirmer average was 13.4. So the learning to use a standardized grading system of MGD will allow to organize an approach to the therapy rather than a random grab bag approach prescribed by the many practitioners. Poor correlation between the clinical signs and the reported symptoms make it difficult for the clinical to apply the scientific basis on this clinical management. The problem is compounded by the difficulty in evaluating the tear film due to its transparency, small volume and the complex composition. The presence of biopolymers is essential, but this did not specifically by the mucus as previously thought factor responsible for tear ferning. MGD is more common in a woman than its incidence increases with the age. Rest of the people also have seen the tear ferning pattern to evaluate the quality of the tear. The tear funding pattern has been investigated for overnight variation, postmenopausal woman, after pterygium and contact lenses wear. So the practical insight into a tear film composition would be a very useful in diagnosis and treatment, but detailed analysis is restricted to expensive and laboratory based systems. No single test for tear function can give a definitive diagnosis as the pattern of ferning depends on the composition of the tear. Ferning test examine the tear stability without involving any foreign substance in the eye, which overcome the limitation of the other tests and helps in quality analysis of the tear film at a gross biochemical level. There is a pressing need of a simple test. The tear funding test has a potential to be applied in the clinical setting to investigate the tear film in a very simple way. Care should be taken not to elicit a reflex tearing as a limitation. Light microscope is often available but can be used rather than 40 lakhs rupees instrument. Test affected by the extreme conditions of the temperature and humidity. Thank you.